Good afternoon, everyone. I'm Jason Rostomily. I'm one of the physical therapists here at Prairie Rehab. Today we're going to talk about waiting for your total knee surgery. So you might be at home right now thinking, man, my knee really hurts. I wish there was something I could do for it until I'm capable to go get my total knee surgery. So today we're going to go over a few ideas, a few home exercises that you can complete until that time comes when you can actually get your surgery. Anytime through this, if you have any questions, you can just write them in the comments below and we'll answer them later. So first, we're going to talk about cold packs and warm gel packs. So generally, they come in all different sizes. We have little ones here at the clinic, we have bigger ones. These brands that we have, you can either heat them up in the microwave or boil them in water, or you can just throw them in the refrigerator and the freezer and cool them down. So a lot of times we get questions, which is which? Should I use cold pack? Should I use a warm pack? So we generally say for pain, swelling, and inflammation, it's a good idea to use a cold pack to help control your symptoms. Now, if you get up in the morning and your knee joint is feeling really stiff, then it might be a good idea to use a little heat on it. Whenever you're using any heat though, we generally say 10 to 15 minutes, because too much heat can actually, long-term use of heat can actually increase inflammation to the area. So it's a good idea to brace. And I just pulled one out, and there's all different kinds of styles, all different kinds of models to use. So it's just important to remember, due to the numerous styles and knee supports and sleeves, it's a good idea to have your therapy team or your medical team help choose what's a correct fit for you. When you're completing activities and you feel like your knee is just not able to support you well, or it's causing you to have a severe limp because your knee is hurting so bad, or the pressure through your leg is just too painful, maybe it's time to think of a supportive device such as a cane or a walker. Again, it would be helpful to have your therapy or your medical team adjust your cane or walker for you and have them complete the proper education on how to use it correctly. Next, it's important to keep in contact with your primary physician or your orthopedic surgeon about your pain management. There are numerous pain medications, medicated patches, anti-inflammatory medication options to discuss with your medical team. Some people also find herbal supplements to be beneficial as well for anti-inflammatory effects. But again, it's important to notify your medical team of what you're taking, as there may be interactions with prescription medications that you need to be aware of. Now, onto the exercises. There are several exercises that you can be completing at home. Home exercise programs help your legs and your knee joint keep strong, helps you keep it strong currently and in the future when you're able to have your total knee surgery. A strengthening program before surgery can help you decrease your recovery time after surgery. And we're going to show you several exercises you can perform. We generally say complete 10 to 15 reps of each exercise a couple times a day. Muscle fatigue while completing these exercises is okay, but you should not experience sharp pain or extreme pain. Modify as needed, and if you have questions, you can email or call us here at Prairie Rehab. Exercises you can complete at home are, and we're gonna move on over this way, and we're gonna go through a few of these exercises. So I have Chase with us today. He's gonna model these exercises for what we call heel slides. So a basic heel slide is you're just taking your heel and you're sliding it back, making that knee bend and straighten. You'll just do a couple of reps here. Again, at home, you're going to complete 10 to 12 to 15 reps. Now, if you're having difficulty with this, and it's too painful or just not working, we're going to have Chase come up into a sitting position, and we're going to give him a towel to use. And he's going to use this towel, bring it around his foot, and we'll do about one more. Very good. Another one you can complete while you're in the same position is what we call hamstring sets, or ham sets for short. This time, the muscles we're working are on the back side of the leg or under the leg. And to get a good hamstring set is what you're going to do is you're going to kind of dig that up. A glute set, generally, what we do is you're going to just contract, and a lot of people call it the penny pinch. Hold it and then relax, just like Chase is doing. You're going to tighten and release. Okay. Next we're going to do, moving on, again, while we have him in this position, we're going to do what we call four-way straight leg raises. So the first one we're going to do is we're going to have him bend this side up. This is his non-surgical side. This is going to be the side you're going to have surgery on. This one's going to be straight. And he's going to lift the whole leg up, keeping it nice and straight and about even with that opposite knee. Nice and slow and controlled, up and down. And again, no sharp pain, fatigue is okay, 10 to 15 reps. Now, like I said in the beginning, it's called a four-way straight leg raise. So I'm going to have Chase roll towards the wall here. This bottom leg is going to bend a little bit. The top leg is going to stay straight, and he's going to do the exact same thing. Keeping that leg straight, he's just going to lift up and down. I'll Chase do a couple more just so you can get an idea of what we're doing. Very nice. Okay, now he's going to roll all the way over and he's going to face us. Same thing. Bottom knee is going to be bent. Top leg is going to be straight. You're going to try to keep it nice and straight with your whole body. And he's just going to lift up and down. And remember, nice, slow, controlled motions. Good. Now Chase is going to roll onto his stomach. And again, this is his side that's hurting. So he's going to just do what we call a straight leg raise while he's on his stomach. So he's just going to lift up a little bit. And again, these are a little bit more difficult. So again, do to the best of your ability. Very good. Now we're going to have him roll all the way back to on his back again. Next, we're going to do what we call bridges. So just like Chase's position that he's in, knees are bent, feet are flat, and he's going to lift up his backside up off the table. So Chase is in pretty good shape, so he can do the full motion. If you can only come up a couple inches, that's okay. Just again, to the best of your ability. All right, now we're going to get him off the table and up in sitting. First, we're going to work on what we call knee extension or long arc quads, where you're basically sitting and you're going to straighten that leg out to the best of your ability. And again, you're going to hear me say this over and over, nice, slow, controlled motions. And if you want, if you're feeling strong, you can give a little pause at the top and then down nice and slow. Give yourself a really good contraction up here in those quads. Good. Next is just the opposite motion. Now he's going to do what we would call hamstring curls, where he's just going to slide or pull that foot back, making the knee bend. And a nice pause at the end. All right. Now we're going to have him stand up. So at home, you're going to use the edge of like your counter in front of your sink to give you some support, or you can use the back of a couch, holding on to the back of the couch. And we just have a few standing exercises we're going to review and go over. The first one is standing heel raises. So you're just going to go up and down. Bring those heels up, working that calf muscle, up and down. And again, Chase is in good shape, so he doesn't have to hold on to anything, but at home, you can be holding on to the countertop or the back of a piece of furniture like your couch. Another one in standing, we're going to do our mini squats, where he's just going to do real gentle knee bends. There we go. In this exercise, is you're working your quads, you're working the backside, but remember, to the best of your ability. One other one is standing ham curls. So you're going to be facing the countertop, facing the couch, and you're just going to try bending that knee while you're standing. And then after you're done completing these, I'm going to actually have Chase sit down one more time. There's one more I'm going to go over. Sometimes when that leg is really getting tired, getting sore, you might want to stretch that calf out. So you're going to take a towel in sitting, and Chase is just going to take that and do a gentle pull back. And again, when we're doing a stretch, we usually ask you to hold it for 20 to 30 seconds, 2 to 3 reps. Very nice. One other thing that we didn't go over is if you have something at home, such as like a stationary bike or even a new step, if you have something like that, Those would also be great to use. Again, just use it to tolerance. Remember, not all these might be appropriate for you. If you're having any sharp pain, we want you to contact our therapy team, and we can certainly modify these exercises for you to the best, what's best for you. Finally, after exercises, you might want to go back. We talked in the beginning a little bit about those cold gel packs. If you're sore after the exercises, throw one of those in the refrigerator or the freezer. And if you don't have one, what I didn't talk about in the beginning is if you don't have one at home, you can always find some rice, throw in an old sock, throw that in the refrigerator or the freezer and use something like that. Put it in. Remember to always use like a pillowcase or a washcloth between the ice pack. It should be ice pack, washcloth, and then your skin. Don't put anything directly on your skin. Let's see, what else did we want to talk about today? Let's just summarize. So warm up the knee with heat if it's really feeling stiff. Take your medications on a timely basis. Walk using support of a cane or a walker, or possibly a knee sleeve or a brace. Keep in contact with your medical team or our therapy team. Exercise to gain strength and motion. Cool down with a cold pack after your exercises. And again, if you have any questions, you can ask us on Facebook or you can email us. We are now offering a free virtual video chat and an assessment here at Prairie Rehab, and we'd be happy to answer any of your questions that you may have. So hopefully these ideas were helpful for you today, and hopefully you can get that total knee soon. And thanks for listening, everyone. Have a great day.